So what we've done is we've created a search for each of the 36 indicators the EFI tool uses. So if I show what I mean by that, every time you run an EFI score, it's scoring for whether a patient has one of weight loss, visual impairments, urinary system disease, etc. So there's 36 concepts here that look for various codes, and there's a few extra calculators in there to look for things like anemia or EGFRs without a code, for example. And then the score is simply the number of deficits over 36. So if you have 5 more deficits, you would have an EFI score of 0.139, and mild frailty is anything more than 0.12. So 5 more deficits would put you as mild, 9 or more deficits would put you as moderate, and 13 or more would put you as severe. So what we've done is we've copied those concepts into searches here. So we've created 36 searches, one for each of the deficits. And an example of these searches would be something like the chronic kidney disease search, where there are the codes that the concept looks for, which are these codes here. There's also, it looks for things like the microalbumin and EGFR and ACR and its various criteria. Now, we've tried to match the criteria quite closely to the concepts. My only issue is that we do use some CKD codes the concept isn't picking. So at the moment, I'd say this is 97% accurate. We are finding patients that have a few CKD codes, say the G1 to 5 or A1 to 3 codes that we're using for this year's QI, aren't getting picked up by the EFI calculator. What that means is that people may get scored as 5 indicators rather than 4 on the searches. So it may recall patients. And that's a symptom of the way I've made these, which is simply to copy and paste a lot of previous searches we've already used rather than rewriting it all completely, although we've had to do that for some of the searches. And then what you can look for is those who have 5 or more indicators, those who have 9 or more indicators, or those who have 13 or more indicators. So for example, people under 65 have only got 6 who've got 13 or more. Over 65 have got 94 who've got 13 or more. I've validated this against the EFI score, batch score population. And actually that population is 92. The 2 extra patients have a CKD code that the EFI calculator isn't picking up. And the other one had subarachnoid hemorrhage, which I think should have been picked up in the EFI concept for stroke or cerebrovascular accident, but I'm not sure quite where that's gone. And just to show how this sort of search works, we create a search where it looks for greater than 12 of any of those 36 searches, which is effectively 13 or more, which would put them as severely frail. It's slightly difficult. The scoring option here doesn't allow you to say greater than 8, but 12 or lower. So we just exclude those with greater than 12 here. And we've done the same for the mild search, so that it's looking for greater than 4, and it's excluded those that have got greater than 8 or greater than 13. So that what you then get is your consider mild, consider moderate, consider frail. Generally, I've found that it's not very useful, the mild one. I think it picks up a lot of people that I would say are actually quite sort of fit and active, but I think the moderate, the 0.24, and the severe, the 0.36, is quite good. I think the 0.36 in particular does correlate well. When I look at those, I feel, yes, they are a very frail population. The EFI is very good. I think always we could go for 100% code matching, so that you know that when you go into any of these records, they're definitely going to have an EFI score using a calculator greater than the 0.36. This has been a first draft where we've done a lot of cutting and pasting. It's about 97% accurate. What that means is it's picking up 1 or 2, well, 3, up to 3 patients per 100 that perhaps the EFI score will score them lower. So there'll be about 10 in the moderate search here, where they'd only have 8 rather than 9 indicators, because it's not picking up some of their CKD and some of the codes, some of the other indicators. when I think they do have those indicators. But it's pretty good, and I would be tempted to say it's good to go as it is. We could go for extremely high fidelity and make sure that it matches exactly. It's just that takes a bit more work.